On behalf of my co-authors, I want to thank the organizers for the honor of presenting our abstract entitled Time to Recurrence of Clostridioides difficile Infection, RCDI, is rapid following completion of standard of care antibiotics. Results from EcoSpore 3, a phase 3 double-blind, placebo-controlled randomized trial of SER-109, an investigational microbiome therapeutic. SER-109 is a novel investigational oral microbiome therapeutic of purified bacterial spores developed to reduce CDI recurrence. In a phase 3 randomized controlled trial, SER-109 demonstrated superiority to placebo in reducing CDI recurrence at week 8, the primary endpoint. SER-109 achieved a 68% relative risk reduction in recurrence rates compared to those treated with placebo. In addition, safety profile of SER-109 was comparable to placebo. Here we describe results for the secondary endpoint, time to recurrence, in this well-characterized study population. 182 toxin-positive subjects were administered 10 ounces of magnesium citrate to minimize any residual antibiotic that might kill a live drug product of SER-109. They were then randomized to SER-109 or matching placebo, of 4 capsules once daily for 3 days. The primary endpoint assessed superiority in reducing RCDI up to 8 weeks after treatment. Efficacy analyses were performed on the intent to treat ITT population. Secondary efficacy endpoint was assessed of CDI recurrence at 24 weeks, and safety was evaluated in an as-treated population up to 24 weeks after dosing. Confirmed recurrence was defined as greater than or equal to 3 unformed stools per day for greater than or equal to 48 hours, plus a C. difficile stool toxin test, and an investigator decision to treat. Age, antibiotic use, and number of prior episodes were similar across treatment arms. More than half of the overall population were over 65 years of age, and significantly more females were in the SER-109 arm. Roughly 3/4 of subjects were treated with vancomycin prior to randomization. 60% of subjects had a history of 2 recurrences before entering with their 3rd acute episode, and 40% of the patient population had 3 or more recurrences. SER-109 achieved the primary endpoint of superiority in the overall population with a significant reduction of CDI recurrence compared to placebo at 8 weeks of follow-up. SER-109 reduced recurrence rates to 12.4% from 39.8% with a p-value of less than 0.001 and a relative risk reduction of 68%. The efficacy results for SER-109 can also be viewed as the alternative metric of sustained clinical response rate of 87.6%. At week 24, SER-109 maintained durable efficacy with an absolute risk reduction similar to that observed at week 8, which were 26% and 27.4%, respectively. The next series of data will show results for time to recurrence based on 11 SER-109 subjects and 36 placebo subjects with confirmed recurrence. A Kaplan-Meier analysis demonstrated the natural history of recurrence following antibiotic discontinuation, and that there is an early benefit in reduction of recurrence with SER-109 compared with placebo that is then maintained over time. Most CDI recurrences occurred rapidly within 2 weeks, but an appreciable number had recurrences as far out as 12 weeks. Here is a summary of recurrent events observed over a 30-day period and over a 24-week period. A larger proportion, 64%, of recurrent events occurred in the first 30 days, as depicted in the first table. These tabular data are represented visually in the following bubble charts. CDI recurrence is rapid following antibiotic discontinuation, although events were observed beyond 8 weeks. The size of the circle reflects the number of cumulative events over time, illustrating the point that recurrence was over 3 times greater in the placebo arm compared to the SER-109 arm, while the time of recurrence in both arms was rapid, with nearly 3/4 of events seen within 4 weeks. We also do a deeper dive into the 4-week data, showing CDI recurrence is rapid after antibiotic discontinuation, with most events occurring within 1 to 2 weeks. Importantly, SER-109 safety profile was comparable to placebo through week 24, with the most common treatment-related adverse events being gastrointestinal in nature. 3 deaths occurred in the SER-109 arm, none of which were deemed drug-related by the blinded investigators. So in summary, in EGOSPOR 3, SER-109 significantly reduced recurrence compared to placebo at 8 weeks, meeting the primary endpoint, and maintained durability over 24 weeks with an observed safety profile comparable to placebo. Nearly 2/3 of all recurrences occurred within 14 days of antibiotic completion, highlighting the potential need for rapid repair of the microbiome. A significant number of late recurrences in the placebo arm also highlights that a minimum of 12-week follow-up period after treatment may be favored. This two-pronged approach of antibiotics followed by SER-109 may represent a new paradigm in the management of patients with recurrent CDI. Finally, an open-label study for patients with greater than 1 episode of CDI is currently enrolling. Thank you for listening, and we thank the investigators and the patients that were involved in this study.